Where's My Line? Part 2. Getting Under the Professional Hat. We as a society require you as a professional to draw a line between your professional life and your personal life. How do you do that? Think of yourself as wearing many hats or playing many roles in your life. Being under the professional hat with a patient means that when you are with that patient, you are focused on using your skill and knowledge in his or her best interest. It is easier to stay under the professional hat with a patient if you are not involved in dual or multiple relationships with him or her. Consider this scenario. It is your practice to offer an appropriate referral whenever a patient shows signs of having been abused. Also, as this professional, you met the husband of one of your patients in the waiting room of your rehab center. You were quick to befriend him when you discovered that he, like you, played squash at a very high level. You and he have been squash partners and friends for a while. Today your patient, the squash player's wife, is with you in your treatment room. She shows clear signs of having been abused. Instead of raising the matter with her and offering an appropriate referral, you ignore the signs as you chatter aimlessly to her, while saying over and over to yourself, "This can't be happening." Why are you reacting this way? Is it that you have fused the roles of health professional, friend, and squash player? Does wearing this combination of hats interfere with your ability to think through the approach you want to take with this patient? Having familiarized yourself with societal understandings of the professional-patient relationship as discussed in Part 1, you sense the truth value of these understandings. Step into the shoes of this health professional by way of illustration. A massage therapist, you are doing an intake interview with a patient who is recovering from injuries suffered in a car accident. A significant amount of time has elapsed since she was referred by her family doctor, and you ask her why. She tells you she had been seeing a massage therapist prior to the accident and quit because the therapist never draped her breasts when she was lying on her back. This annoys you for two reasons. First, this draping is a violation of the standards of practice and reflects poorly on the profession. Second, the patient's discomfort with the previous therapist resulted in prolonged delay, which in turn resulted in further tissue damage. Standing in the shoes of this therapist, you can go in one of two directions. You can be annoyed at the patient for not having stood up for herself. This approach would suggest that you may have heard about patient vulnerability, but you don't lend it much truth value. Alternatively, you could identify with the patient's vulnerability and support her. The next thing you can do is screen for information that is relevant to the ongoing management of the healthcare relationship. Suppose, by way of analogy, that you've lost a ring in a child's sandbox. If you sift the sand through a screen, you'll find the ring. Likewise, if you sift a patient encounter through this net of societal understandings, you'll catch information that is relevant to the ongoing management of the professional-patient relationship, and bring these moments into the light of reflective awareness. For example, step into the shoes of this health professional in a residential hospital. You approach a particularly vulnerable bedridden patient. You ask yourself, how do I support this patient's autonomy? After this moment of reflective awareness, you speak in a normal voice, mindful that you are speaking with an intelligent adult. Or alternatively, you proceed without a moment's reflection and lean into the patient's face and talk baby talk. Which approach would you want from yourself? The idea is to make the connection between societal understandings on the one hand and your behavior on the ground on the other. So I'm wondering if you can put on your professional hat and step into the shoes of this health professional, a physiotherapist. It's your night to stay behind and lock up, but you have to leave on time. Your mother's caregiver reminded you this morning that she is leaving at the stroke of 6, and your wife and kids are out tonight. You glance through a file. Ah yes, the dancer. The treatment outcome has always been to keep her dancing. Lower back and hip. Prescription medication for anxiety. High strung. You glance at the clock again. I bet that technique I just learned for releasing the psoas muscle would help her. Still, I haven't practiced, and I don't have any printed material, and no time to go into a long verbal explanation. So, your patient comes in. She has considerable pain in her lower back, hip, and lower abdomen, and she's hyper at the prospect of missing her performance at a show opening tomorrow. You glance at the clock. Think about your elderly mother, alone at the house. Think about the psoas muscle. Now would be an ideal time to ask yourself these questions. What is in my scope? What is in my competence? What am I prepared to deal with today? And how do I manage this professional patient encounter to support the treatment outcome? The ideal patient is a consenting adult who makes responsible choices, and the ideal professional, a person who elicits this consenting adult and uses specialized knowledge in this patient's best interest. Think of the ideal as a lighthouse, and think of yourself as the skipper of a sailboat. You are ever mindful of changing weather patterns and the passing of time, and when darkness comes, or the weather changes, the lighthouse is there to guide you to a safe shore. The goal is to be always moving towards eliciting the consenting adult and responding to this adult as a professional committed to using specialized knowledge in the patient's best interest. Think of the goal as a homing device. It is the driving force within you that keeps you moving towards the ideal, knowing full well that the ideal can never be finally realized in a volatile and ever-changing environment. Returning to the analogy of the lighthouse and the sailboat, the goal is that driving force within you that senses when you've gotten turned around. It's the force that moves you to relocate the lighthouse and readjust your sails so you are once again being guided by the lighthouse towards a safe shore. This concludes Where's My Line? Part 2, Getting Under the Professional Hat. Part 1, Separating Professional Life from Personal Life, is also available.